So what we want to do here, kind of to close our meeting, is to take a moment and an opportunity to celebrate. You know, last year and a half ago, we were all handed, well, a couple of years ago, we were all handed with the expectation that CMS is going to have an emergency preparedness rule. And we waited and we waited, and it's going to be here, and the guidelines are going to come out, and we waited. Well, it did come to reality, and if I remember right, tomorrow is, yesterday was D-Day. But I think that's okay. As I understand it, you know, I know people have had surveys. I don't know that they've really focused on the CMS guidelines at this point. So they will in the springtime, sounds like. As far as I know, the people I've talked to, they haven't even broached the topic yet.
You have one surgical center today that is also in my arena, Idaho, North Idaho, that is actually going through CMS survey today, and I just got their cheat sheet from their emergency manager, so I'll share that with Travis, but they are looking effective today.
Great. So I think the exciting part is we have spent the last year working as a coalition to build upon each other, lessons learned, things that we've done, ideas, strategies. We've gone through a process here at our healthcare coalition meetings with work groups based on discipline. We spent some time talking about emergency plans, writing emergency plans, what do they need to include. We shifted that into turning your plans into policies and procedures, had some great presentations, some great information sharing, some great work groups that came together and kind of built upon one another, shared resources, which was really great. Then we spent some time talking about communication plans and how do we deal with the communications aspect. Now we're looking at the training and exercise piece of the component of CMS guidelines. We're actually doing exercises that hopefully a lot of you can utilize and capitalize to meet your requirement. So I think we've done a lot of good things together. And we want to take an opportunity to celebrate that. And we're going to modify the way that we had planned just because of the amount of time. We do have cupcakes, as you've heard, and they do say CMS on them. Sorry, we don't have candles that you can blow out, but it's not a birthday. It's just a party. So we do have some questions that we wanted to kind of look at. And we were going to break into groups and talk about this, but I'm hopeful that we can do this as a large group because we've only got about 10 minutes left. So maybe we can run through the questions and see if people have an answer, if they want to provide some feedback. And if you provide an answer, you get a cupcake. If you don't, you can have one on the way out the door. So our first question, it's been a year preparing to meet CMS requirements. What successes have you seen in the CMS process in your agency? Does anybody have anything they want to share? Lessons learned within your hospital facility? Partnerships that you've built? It has to be anything healthcare related.
Hi, Nathan Dykes with Sunshine Health Facilities. We run a continuum of care of services in the Spokane Valley that consists of both skilled facility or assisted living. We work with memory care clients as well as mental health clients. We have a certified home health agency who is out and about in our county, and adult family homes that are their own little compound across the street from us. So we, going through this process, I was talking to Travis a little bit earlier, and we did a tabletop exercise in our emergency preparedness planning session. I won't go into the details of that. It was about as wild of a possibility, but we also thought that Freeman was a wild possibility too. So that process was really telling to us about some holes within our campus but what it basically did was it created a list of security risks and community connections and et cetera. So going through that tabletop exercise, we're still trying to figure out actually how to go through the active process within our campus to do an evacuation and that type of thing, and how each of the different elements could play a part in that. So, but just the fact of going through the tabletop exercise and the list of items that come out of that has been very helpful.
Has anybody created new relationships or partnerships with agencies that you haven't before?
I think many of them are in this room. So I think the additional suppliers and providers, the ambulatory surgery centers and skilled nursing are all a great benefit for the coalition.
What about question number 2? How did your agency overcome the challenge of doing this additional work?
With great pain and late nights.
Was there staffing issues that you had? Did you hire new people? Did you consultants? How many agencies used consultants? A couple of you? So the rest of us poor saps just had to pick it up and do it themselves. What about oh, she raised her hand. That's an answer. Okay, I'm sorry. We missed it. We missed it. So what about?
I do have to say that the ambulatory community center, surgery center community in Spokane has met more frequently, and Travis even came to one of our meetings. We collaborated just as much as we did when the new DOH licensure laws came out and when CMS upped the ante. So this was a good opportunity to strengthen the relationship within the ASC community.
and I can tell you, these guys were great. I mean, they had big work groups here. They had work group sessions off campus here. A lot of great work that they put together and came together to share resources. So here's, I think, the ultimate question that we want to hear back on. What are the gaps in your planning that we can address at a community level? What is still out there that you need that we can assist with as a coalition? Through collaborative work group sessions, through group presentations, through trainings, any ideas of what we can do to help you out in the process?
I think one of the only, one of many, but with the biggest one, I think from a post-acute care perspective, is transportation. And I think when your logistics are a big factor, that working with the Region 9 and other partners on if you're having to move 200 plus people from one location to another, logistically that can be a challenge. So I think that yes, we would do it, and we would do it with grace and imperfectly, but having partners alongside could certainly help out.
Travis, any questions on the chat room? No? Okay. Any other thoughts, ideas, gaps, holes? Well, you know our email address, hcc@srhd, is that still right? I know you guys redid all your website and everything. hcc@srhd.org. So if you think of anything, as always, please let us know so that we can make sure we start to include that in our general meeting agendas and information. We also have our customer satisfaction survey is another great opportunity that you'll have to provide us with feedback on what we can do better. Okay, CMS work groups by provider types have been appreciated. Is there a format, time, or location that would work better for each provider type? Good question. Sorry, I missed it. So I'll ask this question. Were the work group sessions here at the Healthcare Coalition valuable to the groups that were here? Did we have them broken out correctly, adequately? Yeah, I know you guys were fluid and could move in between. More representation, absolutely. Anything to add, Travis? Okay, great. Well, remember, our next meeting is in January. Thank you very much for coming today and being part of our conversation and for being part of our coalition. And please feel free to take a cupcake. It has special initials on it from your friends from CMS.